You'd be amazed at what the body wants to do. Now, do you have to have surgery? If it's a must, yes. If that's the journey you're supposed to be on, there's nothing wrong with it. You learn to respect, again, the choices. I have to go on many journeys, and one of them was respecting the fact that a soul wants to die. I wish I'd have known all this stuff when my mother died, or maybe I could have stopped it. No, she had to die. I get it. My mother-in-law, my father-in-law, they died a while back. People are like, well, why didn't you heal them? Why didn't you heal them, I want to say. But what it boiled down to is, I had all the answers in the world. But does the soul want it? That's where you have to respect what that soul wants. They weren't consciously ready, you know, or know it. Like Dad, all he kept telling my kids, I'm ready to go. You'll see me in a coffin soon, blah, blah, blah. So when he had to stroke, the kids were like, he's still alive. They were like, Dad, Grandma said he was going to die. Okay. Okay, Grandma couldn't let go. And so I'd give, they would ask for stuff. I'd give them the homeopath. They'd Greg, do this. And then they'd go hide it. You should make bottles and stuff. I found it. They were gone. Mother! Dad! Oh! But they consciously wanted it. Why? Because that's what your kids want to hear. That you're fighting. Because if you don't, then they come along with a pep talk. And you're like, go away. When you get in your misery, you're just like, I wanted to shut the world off. Go away. I remember giving birth. Shoot me now. Just shoot me now. Oh my God, just shoot me now. You can raise a kid, honey, all by yourself. I know you do just fine. Shoot me now. You know, cancel. But the thing was, is that when you get in that state, and that body takes over, and so in order to really respect between the relationship of alternative healing and drugs and surgery, and everybody has a place, and everybody has a piece of the answer, and everybody don't have a piece of the answer, just like religion. All religions are right and all religions are wrong. So, on my journey of learning about when you get in car accidents, and how that trauma, you know, I maybe hit here and my fingers hurt like crazy. Well, the wound's up here, not here, even though it doesn't show up here. And as I'm healing my body, I wake up one morning, oh my God, there's something going on here. I couldn't even get into my spiritual state of mind. I need to go to the hospital, honey. How do you know that? Pain. Went to the hospital. And of course I had to roll on the floor for the next 2 or 3 hours in pain because, yeah, we're doing ourselves. Come to the ambulance, you've been fine. They would take you right away. So then what ended up happening is that I went in and they gave me medicine. Didn't work. Went in, gave me more medicine. And I'm like, this is strange. And what I learned from that experience, and as the pain was continuing, and then the drugs kicked in, oh, but I get it. I had to get ahead of the pain. Then I went home. They said, they says, I think it is. And I'm thinking, they did no tests. That's the part I couldn't understand. Just thank you, God, for the doctor that's going to tell me what I need to know. Thank you for the person that's supposed to be next in line. That's supposed to tell me what I need to know. It couldn't mean not be the doctor at all. Thank you. Within 4 days' time, I had gone and got an operation and the gallbladder removed. It was dead from the inside out. That's an interesting story. And what was I feeling before that? I felt dead inside. I felt alive in other places. I thought, oh, I better really heal this projection. But I had to learn that sometimes an operation is necessary. Sometimes medication is necessary. By all rights, this finger should have been a total French fry. I was making popcorn one evening, and as I'm, you know, it's one of those that go round and round and round, and all of a sudden the thing was jammed. I'm trying to poke it, and all of a sudden, and I knew it was a whispering opportunity because all of a sudden I just tipped it. Oh my, I can't believe I'm doing this! So I stick my hand under cold water. I just created a whispering opportunity with why would I need to do this? I don't want to do this right now. I don't want to participate right now. And I'm thinking, okay, fine. I have to participate right now. I have no choice. All right. So I refocused. What do I do? All I kept hearing is, Joe, Vicky. And they had just told me about how she was in a bad car accident. And they gave her stuff in the hospital to take care of burns. Here it was 10 o'clock at night. And I'm over considerate. Call? You're saying, call. And I'm like, but that's just late at night. Call. And I'm thinking, oh, wait a minute, that's part of the lesson. Oh, picked up my phone. Hey, yeah, I kind of burnt myself and blah, 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 blah. And I says, I'll be right over to pick up. But you ain't doing a thing. You see, it was part of also about letting people help me. I didn't even get the hang of the phone, and they're right at my door. And I usually don't have a man help me, I usually have a woman. Oh, her husband comes up, oh, let me see. Oh, I see, I refuse to look at it, because when you look, like, oh, I don't need the commentary. So I didn't even realize it. He had my hand, blah, blah, he's just doing an ice pack, blah, 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 and, you know, next thing you know, he had to put goo on it, and he put an ice pack, and he put a towel around it, and I'm just, she's over there in my face talking to me like this, and she's all hyper, and blah, blah, blah. I'm like, oh, I'm trying to follow it. Well, he did really good at distracting me. Okay, I dipped it one more time, I didn't look, and by the next morning, it looked like this. I'm like, wait a minute, did last night even happen? Yep, there's the popcorn thing. There's the grease. Oh yeah, I remember the pain. And then on the back, I had left a streak where I missed, where it blistered. Oh my God, it didn't happen. But what I learned from it is that your body does not have to be in pain. See, your brain tells it has to be in pain. When it's supposed to be an accident, there's actually a strategy of how it's supposed to go from good to bad, and then heal back to good. But in this case, my finger never got to register that it went bad. So therefore, it didn't have to go through that decomposing process and then the rehealing process. It just said, okay, it's there. Okay, done. Wait. Guess we're not called in to rescue her finger. Oh, wait a minute. Yes, we can come back here. Oh, so it's amazing what you can learn. You can learn a lot of things. So my question to you is, what type of BS in your life that's happening? And I'm not talking about your bullshit, I'm talking about your belief systems. Because your belief systems are the sum total of your decisions. And you may not think about it, but how do you know what they are? Let me ask you, do you like how your life's turning out? In some cases, yes. In some cases, no. But do you have to live that way because that's what's considered life? I mean, she was a witness. She said she understood that her husband was a teacher. So she had to say, oh, thank you for being a butthead. Thank you. Most people don't even get that far to even know that means that's what it means to be a witness. But, you know what a butt is? It's a belief under transition. Sorry, these little things that come through.